Hello, everyone. This is Dr. Usama. Today, I'm going to talk about stroke, its different types, different causes of stroke, and most importantly, how to prevent it, how to take action immediately if you are seeing someone, if you are having a stroke, God forbid, or if anyone who near you is having a stroke or any symptoms of the stroke. So we are gonna talk about different symptoms of the stroke. We will look at some images of the CT scans as well, and then we will proceed with the uh, presentation. So let's start. Okay, introduction to the stroke. So basically, a stroke is a neurological deficit, an area of the brain that goes, I would say, asleep or dead by the time if if it goes by without blood for almost 24 hours, it is completely irreversible. But for a few minutes, if we rush to the healthcare center, or if the intervention is put into the place, so it can be preventable. Its after effects can be preventable. So strokes sometimes can be lethal, in a sense. Sometimes it lead to the death straight away, and sometimes it lead to disability basically. So stroke can be of any vessel of our body, but in this presentation we're going to talk about brain strokes. So there are two type of strokes basically. One is the stroke which is caused by the reduced blood flow or no blood flow at all, and the other one is that is caused by the rupture of blood vessels that is supplying the blood flow to the any area of the brain. So, so what is stroke again? Stroke is basically a neurological deficit that is caused by disruption in the cerebral blood flow. So basically, we have a skull, we have a brain inside, we have brain matter, we have different blood vessels inside. So what happens if there is any blood vessel gets occluded by any thrombus or any sort of I would say emboli or anything, or any narrowing of the vessels, that all lead to the reduced blood flow to a certain area of the brain. So this will eventually lead to the brain death, or I would say death of that specific part of the brain tissue. And in another scenario, we will talk about the brain hemorrhage, which is also a sort of stroke, in which there is a very high blood pressures in the body, which leads to bursting of blood vessels in our body, in our brain, that can be lethal as well. So it is time sensitive emergency leading to cell death within minutes. So basically, among the stroke types, the ischemic one, ischemic mean, if we divide the brain out of blood, that would be ischemic, meaning low blood flow toward that specific area of the brain. So that would be a time sensitive emergency. So if we rush to the hospital, we doctors put the patient on antiplatelets, I would say blood thinners or any sort of other medicines that dislodges the clot, that breaks down the clot, and I would say resume the blood flow toward that brain area. If within minutes that blood flow is restored, brain activity is restored with the minimum disability or minimum morbidity or mortality for life. So basically, it is a major non-accidental leading cause of death worldwide, and it is number second on leading cause of the death. So it happens mostly in adults, even in older adults, like after 40s, 50s, 60s, 70s, depending on their, I would say, holistic health, depending their whole uh, health of their health overall, their cardiovascular health, their body mass index, their body lipid levels, and their, everything that includes their diet, their daily, whether they are sedentary or whether they are mobile, whether they are active or moderately active or bedridden at all. So all these factors contribute toward the stroke that can be second leading cause of the death worldwide. So for the stroke, for the prevention of the stroke and the from the stroke to happen again, it is very I would say imperative to look at the rapid identification, or I would say the rapid picking up the symptoms rapidly and picking up the exact type of the stroke and exact prompt intervention of the stroke would be a very beneficial for the patient. Sometimes stroke don't give much time. I would say patient expires or collapses immediately if they have a major bleed in the brain, or if the artery blockage goes to the major brain area. So sometimes the mortality rate is high, but other times the disability rate is high because people don't report to healthcare centers due to their overall knowledge in the, I would say, how would you guys explain that if someone is having a stroke and people do not pick the red flag symptoms of the stroke and they delay their appointment, or I would say they delay in rushing towards the hospital. So if even if the patient survives, so sometimes there is a lifetime disability that is associated with that time sensitive emergency. So what happens if there is a stroke and there is a delay in the onset toward to the from the onset to the rushing to the time of rushing to the ER. So that specific brain area will be devoid of the blood, which means there is no oxygen or blood or nutrients are going to that area of the brain. So that brain area will be technically dead in 5 to 6 minutes. So, what does it mean? It means that brain area, whatever its function was, it is going to decline eventually if that specific brain area, for example, if a person's speech area is affected, that person, I would say, had some delay in reporting to ER for intervention, and it might cost them speech for their whole life. So they may not speak again. They may be paralyzed from half body of can be paralyzed, whole legs can be paralyzed, both arms can be paralyzed. So depending on the brain area that is getting affected, uh, this is definitely a time sensitive emergency to rush towards hospital to avoid major disability or death. So functional anatomy of the brain, basically brain consists of cerebrum, cerebellum and brainstem. Let me have a look. Yes, so this is our skull, this is our face, and these are different areas of the brain. So this whole big area is called cerebrum. This structure, this here, sorry, yes, this is cerebellum, and the area which is supporting like a stem from below, this is called brain stem. These are different further these areas are further divided into different lobes or parts depending on their functions. So let's go behind again. So yes, cerebrum, this area here, bigger one with the grooves and lines, this area is basically involved with the major motor, sensory and cognitive functions. So basically feel, sense, or we talk, we walk, we do anything. Basically our muscle functioning is directly related to this area. Our cognitive function, our memory, our thinking, everything is related to the cerebrum part. The next part is cerebellum, this area, brownish area here. So basically what does it do? It is basically involved in the coordination and balance. So if someone is walking, the muscles of the body is being controlled by the cerebrum, but the actual coordination of the walk, the balance of the body is being carried out by the cerebellum area of the brain. Next comes the brainstem. So this is a very vital area of the brain which controls breathing and heart rate. So if someone uh, is involved in a major road traffic accident, and if they get hit in this area, this brainstem area, so this might be leading directly toward their heart I would say cardiovascular system cessation or their breathing cessation depending on the damage. So this area here is very very sensitive area that is directly related to the breathing and heart rate. Next, what is this whole matter is composed of, this whole anatomy, I would say that the brain matter is composed of basic components that are called neurons. So these are basically a specialized type of cells in the body that are highly oxygen dependent and they have no energy storage at all. Some body cells like our liver cells, our muscles have some I would say backup of energy in different forms. If someone goes starving, they convert their storage form of energy into active form of energy. So this is how they can survive for a while without actual without someone having actual food, or if someone is starving for days, if someone is not having adequate blood supply in that region. So muscles gonna have to they can survive actually from a poor blood supply. But the neurons that are very sensitive, that are very highly oxygen dependent, and they do not have any sort of energy reserves, so that makes them very vulnerable to the ischemia. Ischemia is basically reduced blood flow. Again, ischemia is a technical medical term that is used for anything, for any organ that is that have a very low blood supply. So if we are going to say ischemia in brain, that means there is a reduced blood supply in brain. If we are talking about ischemia and in limb, so which means if low blood supply in any of the limbs. Sometimes people have cold tips of the fingers, and sometimes in too much cold, our blood vessels of the fingertips go collapse. They get collapse. So there is a no, or I would say reduced blood supply, which leads to the yellowing of the fingertips at first. Then it goes black because they can I would say resist ischemia for a while because there is a reduced blood flow. But if there is a consistent reduced blood flow in the tips of the fingers, that will lead to the ischemia of that fingertips due to severe cold, which leads to the amputation, or lead to the death of the tissue in the distal part of the fingers and the nails. So ischemia is a very lethal symptom that is related to any sort of blood loss, uh, either due to hemorrhage or either due to blockage, reduced blood supply due to any sort of medical issues. Next, we are going to talk about the cerebral blood supply. There are different type of blood vessels in our body. This area is again cerebrum. This area is cerebellum, and this tiny area here is brainstem. So there are different brain areas that are divided on the basis of circulation of the arteries, of the blood vessels that are coming straight from the heart. There is anterior circulation that covers there's internal carotid arteries that goes from here to upward on both sides. So basically they cover anterior part of our brain. Then there is posterior circulation. It comes from vertebral arteries. So we have a spine and we have blood vessels there as well. So a vessel comes from behind of our spine and it goes straight into the brain and covers the posterior part of our brain. Then these both arteries make a junction together in the middle of the brain that is called circle of Willis. So that they make a plexus or a junction of all the vessels, and then they spread out in different directions to make a collateral circulation. So in case of any major blockage, there are some collateral arteries that are different branches that have spread out from this junction that lead to alternate blood supply. But sometimes this alternate blood supply is not sufficient to make that brain area is that is going ischemic or that is going blood deprived. So this will lead to major stroke. So there are small perforators or lenticular striate arteries that lead to lacunar infarcts. Once small blood vessels spread out from this junction, they turn into eventually small blood vessels that lie at cell level. So whenever there is micro infarcts, very very small or tiny infarcts, there is small blockages or tiny blockages that will lead to small pinpoint infarcts, very very small infarcts or dead areas in the brain. If any sort of blockage happens in those small perforators or small blood vessels. So this is carotid artery that is coming from the heart straight. This is the vertebral artery. So the external carotid artery gets divided into external carotid and internal carotid. I'm not expecting all of you to memorize these branches, but let's have a generalized look over how these arteries are spread in the brain, or how they are covering the whole area of the brain from different dimensions. So this internal carotid artery is making the anterior circulation. It is supplying the anterior area of the brain, and the posterior area of this area is being supplied from the vertebral artery. So this here, these tiny structures are our vertebrae or from the spine. So this artery runs in between them. This covers the posterior circulation. This area is basically the uh, view from inferior side of the brain. So this is how this posterior area is brainstem. This pinkish area is here is cerebellum, and the grayish area, again larger one, is cerebrum. So anterior circulation again was covered by internal carotid artery. Posterior circulation was covered by vertebral artery. So these two arteries from the front and behind are eventually meeting at a central point. This is called circle of Willis, and they have several branches spreading out in different directions for covering the whole area of the brain. So this is a rough idea about how blood vessels are spread out in different dimensions of the brain. Now, how in the next slides we are going to discuss about how a stroke happens, or what happens to these arteries or brain areas when the stroke happens. So again, this is an inferior view of the brain. This line area in the purple is cerebellum. This area here is brainstem, and the pinkish area is cerebrum. So this is again circle of Willis. The artery, main artery coming from back side is vertebral artery. Coming from front side is internal carotid artery. So basically, this purple area is covered by this here. Uh, so this brain area in this brain picture is basically showing uh, a cut from midline. This is the medial or middle side portion, and this side is the ear, the portion that is towards our ear. So this purple area here is, and this one is supplied by the posterior circulation or vertebral artery that is coming from our spine, and the pink area here is supplied by the internal carotid artery that is coming from the front, right here from here. So there are different definitions of the stroke, but the main crux or main information about stroke is it's a sudden neurological impairment due to vascular cause. Vascular cause means due to any obstruction or any hemorrhage or leak of the blood vessels that lead to the neurological deficit that leads to ischemia of any part of the brain that will cause stroke. There are basically two broad types of the stroke: ischemic stroke, which is very common, which means there is any sort of blockage due to thrombus or narrowing of arteries. That means there is not sufficient blood supply, or absolute blockage toward the in the blood vessel that will cause no blood supply toward a certain area at all, that will lead to ischemic stroke. And this kind of stroke causes immediate symptoms, but on CT it these symptoms in CT, the ischemic or the stroke is not very much clear as the time passes, as the brain tissue gets dead. The subtle changes start to appear on the CT. So in the serial CTs, we will see there is a ischemic stroke. On the other hand, in hemorrhagic stroke, there is a leak in blood vessel due to very very high blood pressure. So this type of stroke gets picked in the CTs very quickly. So if a person reports with the symptom of a stroke and they get such CT done, so in the CT there is a clear bleed in the brain. So this is how we differentiate between ischemic stroke and hemorrhagic stroke on CTs. Then there is transient ischemia, which means a transient state in which blood vessel gets constricted in some situations, and blood supply gets restored eventually, which means there is not complete blockage. There is a transient, or I would say intermittent blood flow blockage in the artery, and that gets restored. So the patient might have symptoms for a while, and then they get recovered, and there is no permanent damage on imaging at all. So there are different causes of the stroke, of the ischemic stroke. Basically, main subtypes, or the leading causes are large artery atherosclerosis. So let's break down the atherosclerosis. Atherosclerosis basically means if a person gets old, there is a lot of cholesterol and calcium gets stored inside the lumen of the blood vessels, that lead to thickening and narrowing and hardening of the blood vessels, the main blood vessels, the large ones, which will lead to the narrowing of the bore or the lumen of the arteries, which eventually lead to the reduced blood flow. The next cause is cardioembolic from atrial fibrillation. So cardio means coming from cardiac or heart. Embolic mean anything thrombus or any small particle or any clotted blood that gets dislodged from any blood vessel, and it gets stuck in a narrow vessel. Especially in case of atrial fibrillation, it's a basically cardiac contraction issue in which heart contracts, uh, heart is not contracting like it's is supposed to contract. So it is contracting, but it's retaining the blood in its side, inside of the cardiac cavities. It is not pumping the blood, it is retaining the blood. So eventually the stasis of that blood causes the clotting of the clotting in the chambers of the heart. So, what does it mean when I say cardioembolic? It means a person had abnormal cardiac contraction. Some blood got stored in their heart. It got clotted eventually, and then afterwards, what happened when heart contractility restored, and their heart pushed the blood outside, and that clot that was formed as a result of stasis of the blood in the heart, that will push into the circulation. And initially it will not be obvious, but once it gets stuck in smaller arteries, because arteries goes in dividing and further into branches and small and smaller ones, and spreads out this way. So initially when there is the major aorta, the main vessels that come off the heart, are major ones, are bigger ones, but eventually they get smaller and smaller and divide into smaller branches into every organ, every part of our body. So once the lumen is enough, the clot uh, is floating all through the body. But whenever it reaches to the point where clot is bigger than the lumen of the artery, it causes a severe and I would say immediate obstruction in that specific section of their organ, their body, their limbs, their brain, anywhere. It can be anywhere. So that would be cardioembolic cause. Then there is small vessel occlusion, which means any small thing. It can be fat, it can be a clotted blood, it can be gas that might leak during the infusions, or anything that might get stuck in small vessels that will call lacunar faults. And stroke of any other disease, that can be due to cancer, that can be due to coagulation issues, that can be due to any other disorders. So basically, what are the main causes of the ischemic stroke that will lead to the blockage? One is the narrowing of arteries due to aging and normal abnormal calcification. The other one is due to heart disorders. Blood gets clotted inside, and then it dislodges into the small blood vessel, that will lead to occlusion of any area. Sometimes people get stroke of blockage in their blood supply of their git, their intestines. So their intestines get necrosed, which means specific area of the intestine gets dead biologically. Or if their obstruction is in anyone limb, anywhere in the limb, in lower limb or upper limb, So that will lead to the ischemia of that part of limb, so that area goes biological dead again. So let's have a look at the CT of the brain. Again, I'm not expecting you to understand everything, but here is a very, I would say, layman knowledge that everyone should have. Every this awareness, this much awareness they should have about the stroke. So we were talking about the ischemic stroke, which means reduced blood supply. So these are different cases: number one, number two, number three, number four, number five. So these all are different. So this one, this area, darker area, you will see a CT. First of all, if the both areas are even on both sides, which means the area is normal as a layman. But if there is light shadowing or very dark shadowing as compared to the other areas of the brain, which means something is wrong here. So if there is a blood in brain matter, it will look whitish on the screen, on the films. But if there is reduced blood supply, which means which will their area will be hyperdense, which means there is a blackening of area, there is dead tissue that is going dead due to reduced blood supply. So this blackish area I am putting my laser on is area that is getting necrosed due to reduced blood supply. This area is again labeled with the purple contrast here. So this was the case one in which frontal lobe of the cerebrum was involved. This smaller area from the posterior area of the brain is involved, this purple area. So this is a ischemic stroke. This one here is a ischemic stroke. So and this one here is streaming. So this and this image of these are the images of same person, but the in the one row these are different cases. So in this area, this there are small lacunar uh, infarcts or strokes, which mean apparently brain seems fine, but there are very small areas that are damaged as a result of low blood flow. So this area here is a very, very small area in the center of the brain that is also involved in the ischemic stroke. Next one is hemorrhagic stroke. It is a quite straightforward stroke, which means if there is a person, if there is uncontrolled hypertension, which means there is a very, very high blood pressure and their blood vessels are not taking in the pressure at anymore. So whenever there is a weak or I would say fragile areas, they are going to burst from that areas. So they can be kidneys, they can be brain, they can be lungs. So most of the times brain arteries burst as a result of hypertension, uncontrolled hypertension, in which systolic blood pressure goes 200 300, which is normally 100 to 130. So they have a different types depending on the area in which blood is getting clotted. We have different brain coverings going from skull to inside. There is a intracerebral hemorrhage, which means blood in the brain tissue, uh, which we discussed previously. The structure of the brain inside that soft part of the area. Intracerebral means inside of that soft part. Subarachnoid hemorrhage means a rupture of aneurysm or bleed in the one of the coverings of the brain, and it may have higher initial mortality, but have a better long-term recovery. Which means hemorrhagic stroke can be acutely very lethal. If a major blood vessel is burst, which means there is going to be a lot of pooling in the brain, there is a lot of going to be a lot of swelling in the brain, lot of edema, lot of pressure symptoms. So if the person survives all that plethora of the symptoms, the acute symptom, the acute blood supply, so if that gets managed in the time, and if sometimes a person can may have to go under major surgery or burr surgeries to get that pressure released. So this is how they get long-term recovery, because there is no permanent damage, because all the area of the brain is getting adequately perfused. But the main damage here is due to the pressure symptoms, due to the long pooling of blood, due to the infection that comes afterwards. So this is how we manage these strokes differently. We diagnose these cases differently. We have rehab these cases differently. So these are different designs or images of the hemorrhagic strokes that may appear on the CT. As I said before, blood appears whitish on the CT. So these tiny areas here are the hemorrhagic strokes that are spot shaped. Then the swirl shaped. This is a pooling of the blood again, and this is again pooling of the blood. This round circle area, which means pooling of the blood here. There is again pooling of blood here. There is a satellite shape. So these are different shapes that are given on depending on the brain areas and the shape that comes afterwards after a bleeding pool in the brain. So what are the risk factors? Let's talk about the things which can be modified or which are non-modifiable. So what are non-modifiable? Age more than 55 is a risk if the person is not healthy, if a person is obese, if the person is smoker, if the person is not having adequate daily cardio, I would say cardio or any active metabolic activity. Males are more prone. Family, there if there is a family history of strokes, some ethnicities are prone to the strokes, such as Asians and Africans sometimes. So these are the research based things that I have written here, that these things are non-modifiable, which means you can't change these things. If you are above this age, which means you are a higher risk relatively to the other individuals. So even sometimes some people, or even in the ethnicity that is in the risk, if they have family history, if they are males, if they're above 55, but if they have cholesterol levels in the normal ranges, and if they are having daily cardio, or if they are adequately active in their lifestyle, if they're not obese, if they are healthy, if they're non-smoker, if they're non-alcoholic, so there is a fair chance that they might not have a stroke. So what does it mean? These modifiable factors means, which means they are the factors that we can't change, which means they put relatively these people at higher risk. What are the modifiable factors? One of them is hypertension. That is the most important. If a person is having if they have diagnosed hypertension, they must be having antihypertensive at any cost, and these are lifetime medications that have to be taken at any in any situation. So which means uh, if they're not having their antihypertensive, so which might lead to the rapid surge in very high blood pressures that might lead to busting of blood vessels. The next one is diabetes. Person who is diabetic is more prone. If a person is having dyslipidemia, which means very high blood cholesterol, a smoker person, so these factors are modifiable again. These are the things that can be modified, that can be changed, that can be managed with the medications. So these are precautionary measures that can be taken to avoid the situation. So again, the prevention is better than the cure. So if a person is being preventative, being he's taking care of these situations very well, so he might not have a stroke even if they have these situations. Atrial fibrillation, that is a heart condition in which heart contracts abnormally. Again, this is also manageable. Obesity, some people have to lose weight to be in a better shape, to avoid these kind of circumstances. Sedentary lifestyle, so this is also a modifiable factor uh, that may lead to the stroke if a person is not actively taking care of it. Excess alcohol, illicit drug use such as cocaine and other recreational drugs. So, what are the common signs and symptoms of the stroke that can be taken as a red flag? Hemiparesis. Hemi means half. Paresis means paralysis, coming from paralysis, and or hemiplegia. So hemiparesis or hemiplegia mean one side of the body gets paralyzed, which means the area of the brain that is directly related to that area of the body. If that area of the brain is controlling, for example, right side of my body, my face, my right arm, right leg. So if that specific area of the brain gets involved and I do not get it treated, so which might lead me to the permanent paralysis of my facial muscles, my that specific limb, my chest muscles might be affected. My that side of leg will be affected. So I will not be able to move that again. Facial drooping, which means some people might have uh, mild symptoms, but these are again red flags. Even they may seem mild, but they are eventually they can prove lethal. So facial drooping, which means some we have a proper a contour of the face. We even if I'm not speaking, I have my like this. But if a person is having a stroke, they might have like uh, this kind of facial drooping. So their skin might start sagging, their mouth angle might start sagging, might their eyelids might start sagging or drooping. So this is how stroke sets in. They might having a slurred speech, which means dysarthria is a person. If a person is having difficulty to talk, difficulty to I would say organize words or to say anything, like they are having a broken speech or anything, aphasia. Sometimes I have seen patients personally that goes aphasic completely. So which means there are two areas. One is Broca's, the other one is Wernicke's. You do not have to remember these names, but these are two areas that are directly related to the speech, which means they let us speak. So aphasia means the person goes quiet like this. So they do not speak at all, which means their speech area is affected. Their brain is not having the ability to make them speak. So vision disturbances, they might have hemianopia, diplopia, which means they might having like eyesight which with half area is blacked out, and they might having a incomplete vision. I would say might have separated vision. They might be seeing from half of their eye, or one side of their eye goes black in the vision. They might have gait imbalance because, as I said, we have an area that is cerebellum that is directly related to the coordination and balance of the body. If that area goes involved, we might have vertigo, we might have gait imbalance, we might not walk straight, we may not have balance activities like from fingertip to nose, from eyes like this. So that area, if that area goes involved, cerebellum part, so we will lose imbalance, we will lose body balance and coordinated movements. The patient might have severe headache, especially in subarachnoid hemorrhage. Especially in the case of hemorrhagic stroke, patient might be presenting to the ER, might be presenting to you. If someone around you is having a stroke, they might be complaining of very, very severe or worst headache of their life, thunderclap headache, or the patient describes some these kind of words. They are having worst headache of their all. If someone is uh, I would say having thunderclap headache. They're having pain in their head from all sides. So this is where the pressure is building, which means the artery is ruptured, blood is getting start to pool in the brain, and that is causing the pressure. To put on that pressure causes pain in the brain. So how do we recognize stroke? So B fast is the mnemonic that will help you to identify the stroke, and which will lead to the effective diagnosis and quick management of the stroke. So we will go with the B first. B means balance. The person might lose balance or coordination, or they might seem very dizzy. And then the eyes. They might have a sudden visual loss or double vision. Then they have a face. They might have asymmetry or drooping. They might have arms weakness or drifting off their any body part. They might lose coordination. They might lose speech. They have slurred or incoherent speech. They're not making any sense. They're trying to make up words, but they do not make any sense. So the last part of the mnemonic is T, which means time. So this is a time sensitive emergency, which means they have they have you have to call the emergency services. In America, they call 911. In other countries, they have different emergency hotlines, so they get helps in that time specific emergency. So and they get diagnosed and get proper intervention in time to avoid a potential morbidity, mortality, or disability for lifetime. So next, what are the diagnostic tools and imaging that we can use? First line is CT brain that rules out hemorrhage. So it is a first line that is a go-to intervention that usually we do in ER settings to rule out the hemorrhagic type of the stroke. Next one is MRI that is more sensitive for ischemia or reduced blood flow. So the first part, the CT is more sensitive for the hemorrhage, and the MRI is more sensitive for early ischemia, which means reduced blood flow. Then we have different modalities for occlusions or stenosis to detect if there is a narrowing of the arteries or if there is a blockage. We have echo for to rule out the cardiac source of emboli, and then there is a carotid doppler to check if there is any sort of thrombus that is dislodging in small particles and that is getting dislodged and pooled in the blood and get eventually stuck in different blood vessels that will lead to stroke. Then we have different other lab workups for the etiology or exact disease cause of the disease. So then we have different medical interventions. We have thrombolysis uh, that should be happened if there is a ischemic stroke within 4.5 hours of symptoms of the onset, which means if within 4.5 hours of the uh, onset of the symptom, if the blood flow is restored, which means there is a reduced chance of disability. There is mechanical thrombectomy, which means we have surgical interventions or vascular surgeons do mechanical thrombectomy, which means uh, breaking down the clot that is stuck. That can be done within 24 hours in eligible cases, which means a limb or a specific organ is saved. So in that case, this is being done. BP control. In case of hemorrhagic stroke, we maintain blood pressure of 185 by 110, which means we have to maintain this blood pressure before mechanical thrombectomy, because if we reduce the blood pressure quite too much, I would say too suddenly, which means there is a quick reduction in the blood pressure of all the vessels of the body, which will lead to immediate risk of uh, the ischemic, more ischemic damage in the brain. So one is already hemorrhage, and another, if we reduce the blood pressure too quickly, which means there is a chance of ischemic stroke as well alongside of the uh, our hemorrhagic stroke. Then if there is no TPA given, which means within 24 to 48 hours, that is a potential treatment. But if it is not available or accessible, we'll start on blood thinners such as aspirin. Anticoagulation for cardioembolic causes can be started depending on the infarct size. Uh, on after emergency meds or drugs, we can start immediately or can start it from 3 to 14 days, depending on the infarct size. So the blood supply gets restored and eventually things start to repair, and what that area of the brain starts functionally again normally start functioning. So the even after the stroke management and everything, the major role of recovery is directly related to the rehabilitation or by the physiotherapy or other rehab measures. So, in case of any kind of stroke, there can be disability related to it. There can be muscle weakening. There can be speech difficulties. There can be any other relevant difficulty that is related to that specific area of the brain. So that can be managed or by physiotherapeutic intervention, by electric modalities, by anything that helps to restore the brain signal toward that areas. So, what happens if a person is having hemorrhagic stroke and we have received the patient into the ER? We admit the patient to the ICU. We do rapid BP blood pressure lowering, but we do not lower it too much. We have a target of systolic between 140 to 160. We have reverse anticoagulation if a patient is on already on warfarin or direct oral anticoagulants. We manage the raised intracranial pressure, which means if a person is having active bleed in their brain, the blood is starting to pool in that cavity. That space is getting occupied with a lot of fluid, which means there is a lot of pressure. which leads to raised intracranial pressure. So what we do in that case, we elevate the head. We do some give some IV drugs that lead to extraction of the extra fluid from the brain into the blood vessels, and eventually that is removed through the urine through our kidneys. And then is sedation. If a person have a very high intracranial pressure, if they have a stroke, and if they are very agitated, or if they are having any sort of seizures, we might put them on sedation. We might sedate them with various drugs depending on the hemorrhagic stroke or the specific area or the scope of the case. We might do surgical intervention. We might do hematoma evacuation, which means there is a small burr hole surgery that we do sometimes to relieve the pressure quickly to avoid a permanent damage if there is a too much pressure in the brain due to the very high quantity of the blood that is accumulated in the cavity. Ventriculostomy, which means there is several sections in our body or cavities. We do some surgical intervention in that cavities that lead to drawing of the blood in our spine or through other uh, areas, or we extract extra fluid from that area by catheters or different interventions. There specific interventions are not scope of this lecture. So again, this lecture is based on the scope of this lecture is, although it is very, I would say, high yield for laymen, but it's still, it is very important and imperative to have awareness for stroke, for type of the stroke, for red flag symptoms of the stroke, and what can we do if we get it reported to the ER, what if we call emergency services ASAP, which means and by explaining these treatment options, I am trying to explain that there are treatments available that can be done promptly to avoid any sort of mortality, any sort of morbidity, or any potential disability. So, what is stroke rehab and recovery? So, which means ideally within 24 to 48 hours post stabilization, after the stabilization of the patient vitals and the patient condition clinically, we start rehabilitation ASAP. We call in physiotherapist. That physiotherapist will do their intervention to mobilize the patient's limbs. If any sort of area is weak, they might do different exercises to make that area working again. The next one is multidisciplinary team, which means we have physiotherapists, we might have occupational therapists, we might have speech therapists, might have neuropsychologists. So it is a very, I would say, multidisciplinary approach. If a person is having speech therapy speech issues, we might have a speech therapist on the team, on the board. Occupational therapist, if a person is having specific issues with their skill, if they're not able to speak, if they're not able to move their limbs, we might have PTs with us. We might have a neuropsychologist, which means a person might have a cognitive decline, so our neuropsychologists might help us better. And regarding aims, the aim of the rehab is basically to improve the mobility, to improve to improve the odds of reducing the potential disability, to improve the communication and prevent complications. So it is a very long journey, like the cancers, but in it recovery happens usually within 3 to 6 months completely, and the patient is just as fine as they were before the stroke. So the secondary prevention and risk reduction means we might have lifestyle modifications like diet, exercise, quit smoking and quit alcohol, medical therapy such as if a person is having issues with their blood or cholesterol levels, they might be put on aspirin or blood thinner like clopidogrel. Your MDs can prescribe these medicines according to your health conditions. Then we have statins that lower the blood cholesterol. Sometimes people are put on the statins as well. Sometimes we have other anticoagulation medicines that are used if a person have prosthetic valves in their heart, or if they had any heart surgery before, or if they are having any sort of contraction issues with their heart. So to avoid the stasis or blood coagulation in their heart chambers, and anticoagulation is prescribed. BP and glucose control is prescribed in antihypertensive and anti-diabetic medicines are prescribed in diabetic patients. So there are other procedures as well that can be carotid endarterectomy, in which some blood vessels, if they are permanently damaged, we have to do some vascular surgeries on them to repair the blood vessels. So, what are the summary and the key takeaways? Which means stroke is preventable and treatable if acted upon early. As I said, it is a time sensitive emergency, which means if you call in emergency services as soon as a person is having onset of symptoms or any red flag symptom that I said before. Ischemic strokes are more common, so hemorrhagic, which means ischemic strokes are common, but they are not lethal. They lead to disabilities. But hemorrhagic strokes are less common, but they are lethal, which means high mortality is linked to the hemorrhagic strokes and high disability is linked to the ischemic strokes. Prompt diagnosis and treatment significantly improve outcomes. Definitely, as I said, immediate reporting to the emergency hotlines and reporting to the ER, getting it treated, getting a rehab, or getting physiotherapy or any sort of rehabilitation done. That specific area is targeted and the patient is improved, and they might have a rapid recovery. If they have a multidisciplinary team approach, they will get a complete rehab, and if they control their modifiable and non-modifiable risk factors, they might have a secondary prevention, which means they will avoid another episode of the stroke if they take their medicines regularly, if they are changing their lifestyle, if they are making their lifestyle more healthy, I would say. Then that's all. So these were the that was all about stroke. And if you guys have questions, please feel free to ask.